Thank you, Mr President. I rise to second both items 4 and 5, and in doing so I wish to direct my remarks to give members more information in relation to the overspend. As the Honourable Treasury Minister has already stated, during the financial year to the 31st of March 2018, the Department of Health and Social Care forecasts that its expenditure will exceed its revenue budget by up to £9.5 million. And so we are today seeking the approval of Tynwald for a supplementary vote not exceeding this amount. 3 areas are producing the main financial pressures. The first being overspending at Nobles Hospital, forecast to be £11.3 million. The costs of treating patients in the United Kingdom, which is expected to be £1.1 million more than budgeted, and also government catering services overrunning by £1.3 million. I should stress that other parts of the department are managing to deliver services within the budget set for them, and in some areas expenditure is running below budget. Underspending can and will be used to offset the pressures which I've just mentioned. In light of this, the net forecast for the whole department is overspending up to £9.5 million. I can assure this Honourable Court that the department will be making every effort to improve this position, and at the moment I believe we have a good chance of achieving a year-end result below that figure. However, honourable members will understand that for a department providing demand-led services, a level of uncertainty about the final position will be there. Mr President, before I continue, I should wish to place on record my thanks on behalf of the department to the Honourable Member for Douglas South, Mrs Beecroft. Much of the positive work to which I will refer to later in this speech was commenced under her tenure as Minister, and it is important that we do recognise that today. Of course, as everyone is aware, I have only recently been appointed to the department. In accepting this role, I know full well that significant challenges face the Isle of Man health and social care system, and that significant changes will need to be introduced in order to address them. I'm sure that everyone on the island will recognise that changes are and need to happen in our services, and I will talk more about that in a moment. But it is apparent that if we are to deliver a service that is fit for the 21st century, then all of us need to work together to deliver the change that will bring about both long-term certainty and stability. I want, in essence, to restate what my predecessor said to Tynwald Court last year at this point, Mr President. I take what many will see to be poor financial performance very seriously. A commitment was given that living within the resources available will be the department's highest priority, and this has been at the forefront of the department's considerations throughout the year. To live within our means must lead the Department of Health and Social Care to reduce its costs, which then throws up difficult decisions about what we support financially and about both the quality and quantity of what we provide. At the same time, I am sure that no honourable member present today would disagree that cost efficiency must not and cannot be at the expense of patient safety. As with all difficult matters, priorities have to take into account and choices have to be made. I can assure this Honourable Court that I am committed to providing an effective and efficient health and care system in the Isle of Man, one that is sustainable in the long term and fit for the 21st century in which we live. At the same time, I will insist that we must have the right number of suitably trained and qualified staff in the right places who must deliver care safely while respecting the needs of people and their dignity. We must inform people with candour and seek their consent properly. Our premises and equipment must be appropriate for their purpose and maintained properly. We must safeguard people of all ages from abuse. We must have a complaints system that listens to people, investigates their concerns and takes action when problems are found. There is room for improvement in all of those areas that I've just mentioned, Mr President, and I am concerned that resistance to change and our financial difficulties could hold us back. I do not intend to list again the well-known challenges faced by the health and social care systems, not just in the Isle of Man but also in the rest of the developed world. Suffice to say that I think we are approaching the time when both Tynwald Court and the people of the Isle of Man need to consider the sustainability and durability of our current health and social care model. In making this comment, I do not imply any structural shortfall in the department's budgetary settlement, rather that we need to have an informed conversation with the island's communities to understand what people expect from a national health and care service and how we can best deliver on those expectations. There is a review underway of the funding options for the long-term care, and I think we need to consider and review the funding models for the wider health and care system. Mr. President, I now turn to our financial situation in more detail. Honourable members will be aware that the biggest challenge at Nobles Hospital is filling our medical staff vacancies. Linked to that, the greatest financial challenges come from the use of temporary doctors and other health professionals via agency and bank agreements. We are forecasting that expenditure on those temporary staff at Nobles will be more than £14 million over budget by the end of the financial year. Although underspending associated with unfilled vacancies leads to a net position of just under £8 million. I would like to stress to the Honourable Court that my department has made strenuous efforts to rectify this position, and members will recall that this is a core element of our cost improvement plan, but we simply have not been able to achieve what we wanted to do. In the 12 months to the 30th of November, we recruited 30 nurses and midwives, and also 35 doctors. In the same period, however, we lost 21 nurses and midwives and 23 doctors, and so to some extent it has been a case of one step forward and one step back this year. I'd particularly like to take some time to explain just why we are particularly vulnerable to incur locum costs, especially for covering consultants' posts. The island has a small healthcare system, and in a number of our speciality areas we have traditionally operated on a single-handed consultant basis, meaning that when a consultant is absent for leave or sickness, for example, we are faced with little choice but to use temporary resource. In the case of a hospital consultant provided by an employment agency, the cost can be 2 to 3 times higher than the salary of a substantive doctor. To reduce this risk, we are changing our approach at Nobles Hospital and recruiting more consultants. When they are in place, we can better plan for absence through cover with our own staff and significantly reduce the need for us to employ expensive locums. The bill for medicines at Nobles Hospital continues to be a significant cost pressure. We forecast that this year the cost of drugs at Nobles will be £7.2 million, some £1.4 million over budget and almost £1 million more than last year. One of the great successes of modern medicine has been the effectiveness of new drugs. As an example, consider cancer treatment. Historically, patients would be diagnosed and treated. The drugs were effective enough, but the range of treatments was limited. Hence, people used to think of cancer almost as an automatic death sentence, with just time less to live as a variable. With the first or second line drugs failing, there was little left to use. Nowadays, people can expect to be treated for cancer far more effectively. The concept of a cancer survivor or living with cancer is relatively recent. Whilst we should, of course, celebrate this success, it does mean that patients can be prescribed drugs which may be expensive for long periods, possibly even indefinitely. Notwithstanding the above, the department has been seeking to reduce costs on an individual basis by prescribing cheaper medicines where clinically appropriate. We will continue to explore ways to manage the medicines bill, but we have to accept that if we want to provide modern treatments for the population of the island, costs will always trend upwards. Mr. President, we have faced significant headwinds whilst implementing our cost recovery plan this year. As part of the 2017-18 budget process, we agreed to a cost improvement target of approximately £10 million, the majority of which was due to be found at Nobles Hospital. To deliver savings rapidly which approach 10% of expenditure at an acute hospital is an extreme challenge, especially where cost effectiveness, to be honest, has not been part of past culture. The challenge has been made significantly more difficult this year. The Director of Hospitals estimates he has faced unexpected cost pressures of approximately £2.5 million. As an example, our doctors' rota is reliant on junior doctors on what are called core medical training programmes to maintain patient and staff safety. Normally up to 6 trainees per year are allocated to us by Health Education England, but this year we were allocated only 1. This has been a problem across the United Kingdom and is not a reflection on the excellent training provided in the Isle of Man. To provide a safe rota, we therefore had to engage temporary doctors at significant cost. As another example, we have incurred large costs this year covering for unexpected and urgent absences of our consultant doctors due to sickness or other reasons. Mr. President, I'm aware that all organisations face challenges, and I am not going into detail to make excuses, but to help the Honourable Court understand the unique challenges that the Department faces. We must provide and maintain adequate health and social care services, and many of them cannot simply be turned off to save money. This naturally leads to a particular challenge when faced with the level of cost reductions we need to achieve. We currently forecast spending about £1.1 million more than our budget on treating patients in the United Kingdom. Our total expenditure in this area is expected to be nearly £21 million, including travel, which is £1.2 million more than last year. Clearly, these costs are demand-led. The size of the island's healthcare system and indeed population would not make it possible or safe to offer all medical specialities locally. We are therefore reliant on purchasing services from so-called tertiary hospitals, mainly in the Liverpool area. The cost of these services depends on the types of treatment which people are referred for. It is most definitely a matter for celebration that health services are now able to save lives and improve the quality of life for people with serious conditions, people who in previous generations would have had little hope. However, new and improved treatments come at a significant cost. It costs more than £500 a day for a bed in a specialist rehabilitation unit for acquired brain injury. A heart transplant costs around £100,000 and a kidney transplant around £50,000. We are in the process of overhauling how we manage our relationship with tertiary hospitals. Many aspects of treatment can actually be carried out on the island, and we need to have up-to-date agreements with all of the specialist units to which Manx patients are referred to take this into account. We are also creating a referrals management process to support this initiative. Our intention is to closely manage these costs and at the same time saving patients the inconvenience and stresses associated with a trip to the United Kingdom. Also, we forecast overspending in our catering shared services of around £1.3 million. Unbelievably, this is actually a small improvement on last year's performance, but remains totally unacceptable. We need to focus on the delivery of catering core business, and a full review of the operation has already been instigated, engaging with staff and staff representatives to assess the current operating model and bring forward changes to put the service on a more realistic and sustainable basis. The Department is also in discussions with the Department of Education, Sport and Culture to determine the best structure for the provision of catering outside healthcare facilities. In July last year, as requested, the Department laid a paper outlining its financial sustainability plans before this Honourable Court. From my previous comments, Honourable Members will understand that the delivery of the plan has been far more challenging than we envisaged when it was drafted. The main cost-saving challenge was reducing our reliance on agency and locum staff, and I have explained our current plans now for tackling this. Other areas of the plan covered the mental health service, where much good cost efficiency work has been undertaken. I am pleased to report that we are currently forecasting that that service will finish this financial year on target, a major significant improvement from last year. Our use of the health roster system has improved during the year, with new controls being introduced by the Director of Hospitals to ensure appropriate oversight of rostering and use of bank staff. More work does remain to be done in this area to improve staffing efficiency, but improvements are being made. We are on course to review in depth three service areas using the programme budgeting technique this year. This will allow us to identify whether the actual costs of a service compare to expected levels. Time must be given for any resulting service redesign to be implemented, but this represents a good first step towards a better allocation of resources. The integration of care is a central aim of the Department's strategy. We have recently merged the mental health, adult social care and community services divisions into one directorate with one senior leader. This is a significant step towards breaking down internal barriers. We have formed a programme board to oversee this core element of our 5-year strategy. We do continue to suffer from high levels of staff absence through sickness. An action plan for Nobles Hospital has been implemented, with direct support provided to line managers to assist with management of this important issue. However, to date, there has not been a significant improvement in the levels of staff sickness. From the work undertaken, it is clear that significant improvement is going to be a long-term objective, and that to get sustainable improvement, we need to consider a wider wellness initiative across the department. I am pleased to report that delivering the digital strategy at Nobles Hospital continues, and key elements have been introduced this year. A new electronic prescribing system for inpatients at Nobles Hospital, Ramsey Cottage Hospital and the Mental Health Service was purchased in August 2017. The new system, developed in association with a UK-based specialist, is expected to go live this year and will mean an end to paper-based prescribing for inpatients. During the last 6 months, we have promoted and will continue to promote GP patient access, the free online facility that allows people to make GP appointments and view their own health information online. In June last year, the department launched a new digital system for pathology and radiology services, which will cover both the ordering of tests and the delivery of results back to the appropriate healthcare professionals. The move to digital health records and away from the current paper-based medical folders is now in full swing at Nobles Hospital, with the first patient files being scanned and made available to health experts in a live clinical environment. When completed, the project will see in excess of 100,000 medical records transferred into a digital format, with more than 16 million sheets of paper eventually being eliminated. Electronic prescribing of medicines is also on plan and will deliver both efficiencies and better levels of patient safety. Mr. President, the current financial performance of the department is not acceptable. However, I need to stress that the results are not for lack of them trying. To illustrate our progress, I have asked my officers to produce actual expenditure year on year for each division, adjusted for any structural movements in budgets and costs. The review shows that the underlying cost increase this year at Nobles Hospital is around 3.5% in cash terms, which does include pay awards. It is important to view these numbers through the lens of the department's levels of activity. We easily forget sometimes the scale and scope of our operations, which touch the majority of, if not all, the residents of the Isle of Man in one way or another. For example, during 2016-17, the department arranged 16,600 trips to the UK, including 10,500 patient journeys, arranged 470 air ambulance transfers, received 360,000 requests in the pathology department, and undertook 2 million tests. Saw 30,759 patients in the emergency department, provided 50,953 outpatient clinic appointments, although sadly of those 3,960 patients did not attend, and received and managed 1,196 cancer referrals. Our district nurses covered 2,729 admissions, 2,688 discharges and 52,754 visits in patients' own homes, in care homes and other clinical areas. I could of course go on, but these numbers are only the tip of the iceberg of the services we provide on every day of the year to the people of the Isle of Man. I would also like to take the opportunity to thank the staff in the department for the tremendous work they do caring for the people that need them. It is sometimes not pleasant to be working in an environment where there is significant financial pressure, but they continue to provide excellent professional care. If the court will bear with me, I can illustrate this by way of a recent example. I shall not mention names, particularly since I know the Minister for Cabinet Office is very keen on data protection, but in December, a member of our adult services team was contacted in the early hours of the morning by a next-door neighbour of one of our service users. The staff member attended the service user's home in the middle of the night to discover a fire in the premises, and showing exemplary initiative and bravery, she led the service user to safety. This is one example of the extraordinary commitment of our staff in the department to the people of the Isle of Man. I have already acknowledged that our financial performance must improve, but we should not allow that element of performance to overshadow the value of the service we provide. There has also been positive developments during the past year. We have begun publishing waiting times for the first time. There is much work to do to improve them, but I'm sure that honourable members will agree that publishing the information, no matter what picture is shown, is important. In recognising that there is improvements to be made, I should stress that we have already made great strides. For example, in the 2-week cancer referral time, improvements are being made. In the community, our wheelchair service has reduced its waiting time from 46 days to just 3. We have reorganised and streamlined our community equipment service to improve the service to the public. Our community nursing team hosted a successful visit from Queen's Nursing Institute in August 2017. The Chief Executive of the QNI praised community nursing services highly, saying that what she had seen was fantastic, brilliantly led services and passionate, committed nurses in a whole variety of services. We have introduced an island-wide tissue viability service headed by a specialist nurse. This means that whenever people live on the island, the same standard of care is available to them if they are being treated for ulcers or wounds that are slow to heal. We have introduced a requirement for general practices to have a named medicines management lead who takes responsibility for the prescribing arrangements in the practice. All practices have had software installed to support best practice prescribing of medicines. The department has also piloted a pharmacist working with GPs. Initial feedback from that pilot has been very positive. Not only is this a savings programme, but pharmacists play a critical role in reducing medicine errors in general practice. We are looking at how we can scale up the approach to cover all practices. We have also produced an eye care strategy following public consultation, which will be implemented next year. However, we have already made changes to the macular degeneration service, which means that the numbers of people able to be seen on the island in the fortnightly clinics has increased by 50%, meaning that fewer people, often older people with other health conditions, are required to travel off island for this vital treatment. Our reablement service is a great success. To clarify for members, this service was developed in order to help people who had experienced deterioration in their health or have increased support needs to relearn the skills required to keep them safe and independent at home. This differs from traditional home care in that service users must have potential for improvement in a relatively short period, usually 6 weeks. Between July and September 2017, 8% more people aged 65 and over remained at home after receiving re-enablement in the Isle of Man than in the UK. In addition, during the same period, the Isle of Man received 1.6% more referrals to re-enablement upon hospital discharge than the UK. One of our biggest challenges this year has been around how to update the system for charging for medical prescriptions. Currently, only 10% of all prescription items are paid for. The rest are dispensed free of charge. Last summer, the department consulted on proposals to increase the cost of individual prescription items and to reduce the number of medical exemptions available. Following consultation and the announcement I made earlier during question time, the department will be looking at alternative options to manage expenditure on medicines. Mr President, it is with a heavy heart that once again my department comes forward to seek additional financial support. I hope that I have provided sufficient evidence today to enable honourable members to see that real change is happening and that there is a clear commitment to identify and implement a sustainable financial model for health and care services. Going forward, Mr President, I think that the motion being proposed by the Treasury Minister in relation to a review is absolutely essential to that. I said it on the day I was appointed that I want to see more overall strategic thinking. and every decision we make linking back into a strategy, the review being proposed by the Honourable Member will allow us to deliver that, and I would urge all Honourable Members to support both motions.